Hello, everyone. You all work with me. I'm Samantha Soto. I'm doing this teaching project for my teaching strategies class, and I'm going to record it because if I record it, I get more points. So I'm going to go ahead and we're teaching nasogastric tube placement, removal maintenance for the bedside nurse. So I'm just going to kind of follow through with the slides, which you guys have in your packets. I gave you some notes, some little place there so you can take your notes. Please stop me and ask questions, and we'll try to get through this as fast as possible. And then I'm also going to, we'll do a demo together, okay? Of actually trying to insert the tube, and we'll see what time allots. We'll see what time allots us for, okay?
Go close as possible to her up here,
Okay.
please. Go as close as possible to her. Up further, as far up as possible.
Alright, so these are just the objectives that I created for this actual teaching plan. They kind of look a little lengthy here, but I'll just tell you what they are. Articulate the anatomy of the upper gastrointestinal tract. Describe two types of nasogastric tubes and their uses. Verbalize 3 conditions where a nasogastric tube would be indicated. Perform a return demonstration of a patient assessment prior to nasogastric tube placement. Verbalize the supplies and equipment necessary for nasogastric tube placement. Okay. Demonstrate a suction setup. Perform a return demonstration of patient education on the nasogastric tube placement. Perform a return demonstration of nasogastric tube insertion, security, and removal. List 2 methods to verify correct nasogastric tube placement. Describe maintenance of the nasogastric tube. List 3 documentation methods, and list 2 expected and 2 unexpected outcomes for the course of nasogastric tube placement. So just, the anatomy for this sort of issue is simple. You know, when I think about the anatomy that I have to learn for other things, basically, you have to know your nasal cavity, your nares. You have to know your oral cavity, your mouth, everything connects in the back, over here. The glottis, the trachea versus the esophagus, okay? And then this is the sphincter, the top sphincter of the stomach, and then your stomach. And obviously the jaw would be important to know for this procedure as well. These are what nasogastric tube looks like, what they look like. Actually, this slide was supposed to be over here. These are just some pictures, but I did put several out there for you guys. You can open them, you can look at them. There's different sizes. This one is the one that I figured we could use to practice with because I think it's the smallest, I believe. These guys go by, this is a 16th, so he's kind of a medium size. But there's a 14, there's an 18, and then there's some dog pops in there.
What is that one called, please?
These are the Salem socks. I'm going to go through those in a minute, and I'll talk to you about why we choose a different one.
Do we have them all on the floor?
No, we don't.
Because I was supposed to put one in very recently, and I struggled to find.
No, actually, some of these I did have to run over to ICU and grab. They have everything. They have everything. So, all right, the next slide. Okay, conditions requiring nasogastric tube placement. So, stomach decompression for small bowel obstruction, such as an ileus. I think we've kind of all heard of that word by now, ileus. Okay. Gastric contents evacuation, such as an overdose or a hemorrhage. So, if somebody OD'd, comes into the ER, or even children that might have eaten something poisonous, sometimes they will evacuate. The gastric lavage is another method. Let's see, sampling of gastric contents for analysis, medications and fluids, and feedings. She's sick. Tell by your green face. Okay. Patient assessment prior to nasogastric tube placement. What are the things that you guys need to look for before you would actually go and even attempt to put a tube up somebody's nose? So, if possible, ask your patient for information regarding their past medical history. Be sure to include questions about ingestion of drugs or toxins, nasal deformities, like if people have had their nose broken before, that can affect Epistaxis, that's the great big word for nosebleeds, alright? Facial surgeries, which is actually, some people don't like to talk about that, but we have to ask. It might be one of those hidden things that you don't necessarily see, it's not obvious. Trauma facial or head, trauma to your face or your head. Sinusitis, transsphenoidal pituitary resection. That's where they go up into the brain through your nose. Okay, that way. And sometimes they do sinus surgeries, they'll go up through your nose that way too. So obviously, if somebody's recently had something like that, we don't want to be going up their nose. History of basilar skull fractures, varices, that's another important one, the esophagus. And then recent esophageal or gastric surgeries. Okay, this is just a little bit more on your patient assessment. Please note signs and symptoms such as abdominal distension, nausea, vomiting, absence of bowel sounds, or even, I'll put that up there because that sounds absence of bowel sounds, maybe it's important, right? And note last bowel movement and type. That's why it's so important when you guys do your assessments every morning, you ask the patient, when you assess the bowel sounds, when was your last bowel movement? And is that normal for you? Some people 3 days is normal. I think a little bit more than 4 to 5 days is kind of not, hitting some normal on that. And type. Like, they'll know, are they constipated? Trust me, most people know when they're constipated, and that would be important to know as well. First and foremost, most important thing is that you have to have an order in order to put in a nasogastric tube. You can't just go do it. So if the physician gives you a verbal order, that's good, that qualifies, you can go back and write it later, if it's something that's emergent, but you must have orders from the physician, okay? Just a reminder, don't forget to write the supplies and equipment is basically everything